Tinnitus is a persistent and often overlooked issue, especially for seniors residing in assisted living facilities or communal care settings. In the first 3 seconds, you must know that if your elderly loved one is experiencing a continuous ringing, hissing, or buzzing in their ears, this can severely impact their mental health and quality of life. Therefore, let me delve into the causes and show you the practical, simple solutions to bring quiet and serenity back to the seniors we cherish. The problem: unceasing noise. Gnaws at quality of life. Tinnitus is not a disease, but a symptom of an underlying issue, characterized by the sensation of hearing sounds, such as ringing, whistling, buzzing, or ocean waves, without an external source. For elderly residents in assisted living facilities, tinnitus is a far more complex and difficult challenge. The continuous, unmutable noise causes deep discomfort, anxiety, and depression. It interferes with their ability to concentrate, enjoy social activities, or entertainment, leading to feelings of isolation, frustration, and a loss of control. Notably, tinnitus often worsens when the environment is quiet, especially at night, causing severe sleep disturbance, which leads to daytime fatigue, cognitive decline, and an increased risk of falls. Furthermore, tinnitus makes conversations difficult to hear, particularly if they also suffer from age-related hearing loss, Presbycusis. This causes seniors to automatically withdraw from group activities, communal meals, and community events at the care facility, diminishing the quality of their social interactions. Sadly, staff members often focus on more basic and urgent needs, causing invisible issues like tinnitus to be overlooked or simply dismissed as part of getting old and not proactively managed. The why tinnitus worsens in seniors. The reason why seniors in assisted living often experience tinnitus and have difficulty coping stems from a combination of physiological, pathological, and specific environmental factors. Aging of the auditory system, Presbycusis, is the leading cause. When the tiny hair cells in the inner ear, cochlea, are damaged or die due to age and cumulative noise exposure, the brain does not receive external sound signals. To compensate, the auditory nerves spontaneously generate electrical activity, which we perceive as tinnitus. Next is the side effects of medication. Many seniors take multiple medications, polypharmacy. Ototoxic drugs like high-dose aspirin, certain antibiotics, aminoglycosides, loop diuretics, and some chemotherapy drugs can cause or worsen tinnitus. Concurrently, circulatory issues such as atherosclerosis or high blood pressure can alter blood flow near the ear, causing pulsatile tinnitus, where the sound synchronizes with the heartbeat. In addition, the accumulation of earwax, a common issue in the elderly, can put pressure on the eardrum, leading to tinnitus, and temporomandibular joint disorder, TMJ, is another less recognized but treatable cause. Finally, there are environmental and psychological factors in assisted living. The environment may lack diverse sound stimulation, featuring monotonous sounds, air conditioning, machinery, excessive silence, which makes seniors focus more on their own tinnitus. The feeling of loss of control over their living environment and reduced privacy can increase stress levels, and stress is known to exacerbate tinnitus. Moreover, since tinnitus often accompanies hearing loss, the lack of properly adjusted hearing aids or specialized sound therapy sessions allows the symptom to intensify. The fix: reclaiming quiet and improving quality of life. The solution for tinnitus in seniors is not a complete cure, as one does not currently exist, but the process of symptom management and reducing the brain's negative reaction to the sound. This requires coordination among care staff, family, and medical professionals. First, medical intervention and medication adjustment. Regular hearing tests are mandatory. Hearing aids are the most effective tinnitus relief solution. By amplifying external sounds, hearing aids reduce the contrast between the tinnitus and the environment, making the ringing less noticeable, a phenomenon called masking. Family and care staff must work with the doctor to review ototoxic medications and substitute them if possible. Never discontinue medication without medical consultation. Additionally, nurses should safely and periodically check for and remove accumulated earwax. Second is environmental sound management, sound therapy. The core method is to provide seniors with white noise machines, nature sound generators. This gentle sound doesn't need to be louder than the tinnitus. It just needs to be loud enough to provide a relaxing background sound, which helps distract the brain's focus away from the ringing. This is especially crucial at night to aid sleep. Simultaneously, music therapy by encouraging listening to calm, low-frequency, instrumental music is also beneficial. Finally, stress reduction and neural habituation techniques. If resources allow, consider tinnitus retraining therapy, TRT, a specialized therapy that helps seniors gradually achieve neural habituation to the tinnitus, so the brain treats the sound as unimportant background noise. Furthermore, simple mindfulness and meditation techniques, including deep breathing, help seniors control anxious reactions to tinnitus, reducing overall stress levels, thereby lessening the perception of the tinnitus's severity. Ultimately, encouraging physical activity and social engagement, gardening, painting, playing cards, will keep the mind busy and focused on positive activities, reducing concentration on the ringing. Addressing tinnitus for seniors in assisted living is an ongoing process that requires patience and empathy. By applying solutions ranging from medication adjustment and using environmental sound management tools to relaxation and neural retraining techniques, we can significantly help the elderly regain quiet and improve their daily quality of life.